Down, on your side. Good girl. So I taught Ivy to lay down and roll on her side. And this is what I do to evaluate her after training, heavy training, or after an agility trial. I just want to feel all her joints and muscles, feel her range of motion, and see if there's anything out of the ordinary. So I start with the front end. Like a lot of dogs, Ivy doesn't like her feet handled, but she tolerates it. So I just want to flex and extend the whole leg and see what that feels like. I kind of push on the top of the scapular, which we learned about. And I just want to see what kind of mobility she has in her scapula, because if it's normal, that's fine. If it's abnormal, I need to address that. I start at the top. This is the point of her shoulder. I gently extend her shoulder. Ivy's always been a little tight in her shoulder, so I just gently move it as far as I can and then a little bit more, and that's fine. Now I'm not trying to increase the stretch, so I don't have to hold it for 10, 20 seconds. I just want to know what it feels like, and that feels normal. And then I flex her shoulder with her elbow flexed, and then with the shoulder still flexed. We haven't done this in a while, so she's fussing, but that's fine. With the shoulder flexed and the elbow flexed, I now want to extend the elbow and see what that feels like. That's actually called the bicep stretch, because the biceps tendon runs through here and attaches here. So with the shoulder flexed, if I extend the elbow, that stretches the biceps tendon, and if they have some pain, that's significant, but she doesn't. So that's the shoulder. Then I go to the elbow. I'm going to flex the elbow, make sure I can flex it all the way. Extend the elbow, make sure I can extend it all the way and that she doesn't have any pain. I go to the carpus, flex the carpus, extend the carpus, see if anything feels abnormal. That's normal. Then I just kind of squeeze on each toe just to see if there's any pain. And these are the metacarpals, which we'll learn about, and I just kind of wiggle them to see what they feel like. And then this is something I learned from a chiropractor vet friend of mine. I just take each toe and I put a little traction on it to pull on it, because she said a lot of dogs will kind of jam their toes when doing agility, and this might just stretch things out a little bit. Okay. The other thing I do is I come up here and I feel her triceps muscle, which is a big muscle in the back of the leg. I just want to see if that feels normal. See if there's any trigger points in there, which there often are, and that does feel normal. So that's basically the front leg. Then I go to the back leg. Ivy's not real happy. I should do this more often because she's not used to this. This is our training room, and she's wondering why we're doing this down here instead of training. So she's unhappy and she's expressing it. But we'll do some training when we're done. So I come to the back leg, again, take her foot, just kind of flex and extend, see what everything feels like. Again, I want to start with the hip, so I'm just going to gently extend the hip. And she's fighting me a little, she's a little tense, and that's okay. I'm just going to gently put a little more pressure until she kind of relaxes into the stretch, and there she does. She relaxes into the stretch. I want to stretch her hip all the way, and then I want to check to see if she has any iliopsoas soreness. So I will abduct the hip or move it a little bit away from the body, and then internally rotate it in this way to see if she reacts, and she doesn't. So that's fine. Now I'm flexing the hip, and while I'm flexing the hip, I'm going to extend her stifle. And she lets me do this. This is looking for any tightness in her hamstrings, and she doesn't have any, so that feels good. That's the hip. The stifle, the knee, it's full flexion here, that's good. I'm extending her knee. It doesn't really matter what the hip is doing while I'm doing this. I'm extending her knee, a little bit hyperextending it to see if there's any pain there, and there isn't. Come down to her hock, flex her hock, extend her hock, that's normal. Feel her metatarsal bones, just make sure they can wiggle. Palpate each toe. and pull on each toe as I'm doing that. And then what I do in her hind leg is I kind of just run my finger across her muscles to see if there's any tightness or tenseness. And there always is with Ivy after agility runs, after agility trials. These muscles right here are tight, so I know that. And then when I get home, I just kind of massage her. And I'm not really going to tell you about how I do massage. That's not for this class, but I do massage all their muscles. And that's the hind end. Break. Good girl. Then I stand her up. She's much happier now. And I do cookie stretches. I bring her head back to her hip, to her stifle, to see if she's comfortable doing those stretches. Do on this side, make sure she's got good mobility, and she does. Come here. Stand. Good girl. And then I just stand her in front of me, and I just want to palpate the muscles on her back to see if there's any soreness. And she often has a little bit of soreness in her back. I mean, she flinches. Is that soreness or is it just reflex? It doesn't really matter because I know she's not showing any clinical signs, so I'm not too worried about that. And then usually at home after trials, she likes to sit in front of me while I massage her neck and her back. She's a lot more comfortable doing this standing. So again, I can do all the range of motion and stuff with her standing, but again, I have to worry about her balance and about her walking away, so I prefer to do it with her laying on her side. Good girl.